evening, everyone. Thank you so much for joining us in the Charms MediHelps Foundation first annual Black History Month event. If you stay with us for a few minutes, we will be going live. I just need to sync up with LinkedIn, so please give us a moment. Good evening, everyone, and thank you so much for joining into the Charms MediHelps first annual Black Health in History event. We are actually going live, and we will be going live in a few moments. Just give us a little bit of time to get everything set up. When you come in, please let me know if you can hear me. If you do have a question, please go ahead and raise your hand so that I can see that you have a question and that you, in fact, do have something to share with us. I am going to go ahead and start now. Thank you again for joining us. Hopefully, you're able to hear us. If you have something that you want to share with us, please go ahead and put the comments. For those of you that are on LinkedIn, raise your hand so that we can see you. And for those of you that are on Facebook, please go ahead and put your comments in the Facebook chat. We will be starting very, very shortly. Just give us a moment, please. Okay, and we are back. I am talking this evening to Darlene Fambry Christie. I am so sorry. I am talking this evening to Darlene Fambry Christie. She is live with us tonight on Facebook. She's also talking to us from LinkedIn audio. We are going to go ahead and move on with tonight's conversation. Darlene, before we do that, though, I have to go ahead and give you her background. Darlene is a native of South Philadelphia, now residing in Tampa Bay. She has built a remarkable career, ultimately finding her calling in private patient advocacy, patient safety, and community education. Her professional trajectory commenced with a 30-day temporary assignment, leading to a dynamic career in both qualitative and quantitative research since 1987, with a focus on healthcare research designed to help manage the dialogue and doctor-patient communication. Darlene traveled nationwide for over 15 years, recording exam room visits and conducting in-depth I am so sorry. And conducting in-depth research. Darlene traveled nationwide for over 15 years, recording exam room visits and conducting in-depth interviews with patients, physicians, and other allied healthcare professionals. She also specialized in recruiting ethnographic research and completed hundreds of case studies, emphasizing improved personal health crisis when her husband was diagnosed with prostate cancer and experienced several complications of its treatment. During his intensive care unit stay, Darlene undertook the journey to begin her studies to become a board-certified patient advocate. Leveraging her providers, her husband is now cancer-free, and thriving. She is actually cancer-free and thriving. You guys, please forgive me tonight. Darlene's commitment to patient advocacy strengthened her lived experience as an advocate, role as a caregiver, and also as a healthcare surrogate for her family member dealing with a stroke and vision loss from diabetic retinopathy. Her passion for advocating for those unable to do so themselves, particularly solo seniors with nearby support, is her niche. As a veteran researcher and supporter of continuous education, she now holds a certification in health literacy and is also pursuing additional training and certification in cultural competence to serve athletes, veterans, and our military members and their families. Darlene's professional offerings include providing concierge services for individuals. She enjoys writing, creating content, and promoting empowerment by spreading awareness on the benefits of advocacy services. She serves on various committees to help educate, inspire, and uplift. In her new leadership role with Sports Philanthropy Network. In her spare time, she welcomes quiet time at the beach and loves spending time with family and friends. And before I go further in introducing Darlene, I am so sorry for my slip of words and my reading of her bio, because she certainly is an on-time and a dedicated and passionate advocate. So pardon my eyes for this evening. Looks like I'm having eye problems. So pardon my eyes for this evening. But without further ado, I'm going to go ahead and turn it over to Darlene so that she can discuss with us her journey as a board certified patient advocate, and more importantly, her journey as an advocate for her loved ones, especially her husband. Darlene, it's on you.
Hello, everyone. Thank you all so much for joining us. Sandra, can you hear me okay?
I can.
Oh, okay, fantastic. So thank you all so much, everyone, for joining us. And thank you, Sandra, for that very, very warm welcome. And I just want to give you a big thank you for the fantastic job that CHOM's MediHealth Foundation is doing with this Black History Month program, as well as in the community. As Sandra has mentioned, I am a board certified patient advocate in the Tampa, Florida area since 2023 in the spring. So it's been almost a year. And I was inspired to become a patient advocate after my husband had a series of health crises that were a result of complications from his cancer treatment. And that was due to fragmented care, delayed diagnosis, misdiagnosis, and that caused a delay in his treatment and his diagnosis of congestive heart failure. So altogether, that cost him 40 days in the hospital, 18 days in ICU, and a trauma surgery. And when Sandra first invited me to participate in this program, I wasn't going to get into a lot of deep details about my husband's story. As we set up to do this program, the topic of my title is Taking Charge of Your Heart. And it was to discuss the prevalence of congestive heart failure and heart disease in African Americans. But if I did not go into my husband's story, it would change the whole narrative of this story, because it just goes to show you that if heart failure goes undiagnosed or untreated, it can become near fatal. So my husband's story, I want to go ahead and humanize this story. And the reason for that is because a few years ago, I heard of a story of professional tennis player Serena Williams back in 2017, where she almost lost her life during childcare. And she had to advocate for herself. And that just made me think, wow, if something like that can happen to Serena Williams, it can happen to me, it can happen to you, it can happen to any of us at any time. So again, to humanize this story, just to tell you a little backstory on my husband, his name is Earl Christy. He is a Super Bowl champion from the New York Jets. He's been a mentor and done many outstanding things in his life after his time on the football field. And as far as his diagnosis with prostate cancer, the timeline on that, He was diagnosed a couple days before Christmas in December of 2021. And fast forward to treatment, which started in February, about 6 weeks later, he was going to have hormone therapy, 5 weeks of radiation, and a surgical procedure.
Darlene,
About 6 weeks into treatment, he began to start experience. Yes.
Hold on for one moment, Darlene.
Can you hear me, Sandra?
Yeah, I can, but hold on for 1 second. If everyone can hear us, can you please raise your hand or show us an emotion to let us know that you can hear us? Okay, so yes, you can go ahead. They can hear you. I just wanted to make sure they were able to hear you. You can continue.
Okay, fantastic. Okay, so he was diagnosed December 2021. Treatment started about 6 weeks later, and he started a treatment plan of hormone therapy, 5 weeks of radiation, which was going to be 25 treatments, 5 days a week for 5 weeks, and it was going to end with a surgical procedure. But because of all the health complications that he had, that I'll talk a little bit about in a minute, the surgery treatment plan was changed, and that did not happen. But around mid-April, he started to experience mild wheezing, shortness of breath, and he was just, having a difficult time. And when we went to the doctor, they diagnosed him with seasonal allergies, and they put him on an allergy medication. Now, Sandra has already mentioned that I have 15 years in medical education research, but I do not have a clinical background. However, when they diagnosed him with seasonal allergies, it just didn't seem right. It seemed random. It seemed kind of out of the blue. It just didn't sit well with me. But, that's what they prescribed. So we went on with that treatment plan. Towards the end of April, about 4 weeks later, the allergy medication was doing nothing for him. His health was declining. He was starting to have severe wheezing and shortness of breath. And he had started to have some some swelling in his feet and his ankles. Now, the ironic part is that we have been invited to participate in what was called a huddle study. And this study was for former NFL players and their spouses. And this study was actually designed to increase the awareness of heart disease and also the impact of heart disease in specifically communities of color, where heart disease is most likely to go undiagnosed and untreated. So it was just ironic that we participated in that study on April 30th. We left that study and went to Orlando. My husband is a motivational speaker, and he was doing a speaking engagement. And anybody that knows my husband knows that he does not need a microphone when he's speaking, okay? He has a very loud voice that just resonates. But when he was speaking, I could hear him struggling, and I could hear him kind of short of breath. And I thought, wow, that's kind of odd. And when we got back to the hotel, he took off his shoes, his feet and his ankles were swelling, and he was very short of breath. And I thought, maybe it was just kind of us overexerting ourselves. But I thought back about how they had described the signs and symptoms of heart failure earlier that day. And it just resonated in my mind. I thought about how they said the feet and the ankles swelling, and they talked about shortness of breath and wheezing, and he was doing all of those things. And they also talked about how if a person is having those symptoms, that you should elevate their feet and that you should prop them up on pillows, which is what I did. And it did give him some relief. But I recall laying in the bed that whole night and just listening to him wheeze and struggle to breathe, and, one of the reasons that I probably had not told this story before now is because the wounds actually are pretty fresh. It's been a long journey. It took him 1.5 years to recover. He just got off of a ventilator about 2 weeks ago. But I did that, and I wound up calling his primary doctor and telling her, he's having all these symptoms. We participated in a study for heart disease, and I think he's having an issue with his heart. I said the allergy medication that was prescribed is doing nothing for him. And she got us into the cardiologist the same day. We went to the cardiologist. The cardiologist put him on a water pill, and the cardiologist set up a diagnostic plan that was going to take 5 weeks. They were going to do one test a week for 5 weeks. And those tests consisted of an EKG, an echocardiogram, a venous and ultrasound, and a stress test. Now, meanwhile, my husband was about to start prostate cancer treatment, the radiation, which was going to be the exact same 5 weeks. So if anyone here is familiar with radiation, you may understand that a person has to drink a lot of water. There were times we would go to radiation and they would have him go sit back in the lobby to drink more water because he didn't have enough water in his bladder to complete treatment. So long story short, by the time the cardiologist finally made a diagnosis to let us know that my husband had dilated cardiomyopathy, and which is basically an enlarged heart valve, and he gave us the warning that my husband should not be drinking more than 1.5 liters of water a day. Now, during this time, I was calling the urologist. He's having this swelling, like everything is swelling on his body. And, you know, again, by the time they made the diagnosis and said not to drink more than 1.5 liters of water, he had already collected over 44 pounds of fluid in his body. Okay, the fluid was in his legs. I mean, his legs were just so swollen, he could barely bend them. When we were going to radiation, I would have to literally lift his legs into the car. Like, he would put his backside in the car, and then I would have to lift his legs because his legs were so swollen. They were so heavy. He couldn't bend his legs. And this is what we were dealing with. He was extremely fatigued. He was wheezing. I mean, he had really, really completely declined. So the last follow-up visit for his radiation, I said to the oncologist, I need you to look at his legs and his feet, and I need you to call his primary doctor now. Not tomorrow, not next week. I need you to call now while I'm here and let her know what it is that you see. And he did. He called her. And we went into she had us come into her office. She checked his oxygen. His oxygen level was at 86. His feet and legs were so swollen, and she sent us straight to the emergency room. And they admitted him to the hospital. He was there for 18 days. He was in ICU for 10 days. I mean, it was really, really bad. And at that time, after all of that, that's when he was finally diagnosed with congestive heart failure. And the fluid, as I mentioned, had gotten into his lungs. So that was the reason that we were having all of the wheezing and the congestion. So, you know, that was really just the beginning of a 40-day stay in the hospital, because he wound up being admitted 3 times. But when I go back to when Sandra asked me to participate, I was so honored, because I said, there's no way that I can keep this information to myself. I have to share this with other people, because had I not been able to say to the primary doctor, I don't think this is allergies. You know, I mean, you guys are giving him allergy medication and it's doing absolutely nothing. So I was able to say that only because I had learned a tiny little bit of information that made a difference in how they were going to take a look at what was happening with him. So he wound up getting released from the hospital. He came out of the hospital. He was on oxygen 24/7. They had him on 4 liters of oxygen 24/7. And 30 days later, he was readmitted back to the hospital. And that time, it was because he had gotten extremely lethargic and weak. And he had also gotten extremely confused. He literally almost passed out in the house, and I caught him just in time. I got him back to the chair, and he wound up dozing off. And when he woke up, he started asking, where are we? And we were literally sitting in our living room. And so I knew it was time to go back to the emergency room. We took him back to the emergency room, and because they diagnosed him with hypercapnia. So basically, he had too much carbon dioxide in his lungs. Because of the damage to his lungs, he was no longer able to exhalate like you and I would. And this carbon dioxide was building up in his lungs. and it causes confusion. I mean, they were actually surprised that he was still conscious, and they said that he would have gone to sleep and didn't wake up, basically. So he was in the hospital for a pretty good stay that time. He was out of the hospital and he came out of the hospital. They put him on a ventilator, which helps blow carbon dioxide out of his lungs for him because his lungs were not able to function properly. And when he was released from the hospital on that ventilator, 4 weeks later, we were back at the hospital again. And this time, because he started experiencing something called, I did the research myself and discovered it was air swallowing, which is something that happens sometimes when people are on a ventilator. And he was telling me the ventilator was making his stomach hurt, which didn't make a lot of sense to me. But after I did the research, I understood that it can cause nausea and vomiting. And because he had had a pre-existing hernia, when he was nauseated and started vomiting, he had a hernia that popped out and became strangulated. And I had to take him back to the emergency room. So as you can see how this story is going, I could not make this stuff up. This is a whole series of mishaps that happened because the heart failure was not diagnosed, and it led from one bad situation to another. So took him to the hospital. They took him straight into trauma surgery to repair this hernia. He was in the hospital, to complete that whole 40-day stay. By the time he got out of the hospital, he was down to like 160, just over 160 pounds. So everything kind of went downhill pretty quickly. But what I want to end that part of my story with is the good news that my husband is now cancer-free. I wound up doing research and found out about balloon therapy, which is very effective for people that have breathing and lung issues. So that helped him get off of the ventilator finally after almost a year and a half. And he's thriving and doing very well. But even though, I tried to be as on top of it as I could, it still happened. And had I not been on top of it, I can tell you that we would have had a very different outcome. So I went off onto that tangent just to let you all know, like the seriousness of what happens if a condition like heart disease is not diagnosed and not treated. Now, certain groups, especially Black people, are statistically more likely to suffer from a wide range of chronic and infectious diseases and other health conditions, which includes cardiovascular disease, stroke, diabetes, kidney disease, cancer. And these diseases are some of the leading causes of death and disability in the United States. And heart disease is the leading cause of death for all Americans, but again, certain groups have higher risk than others. So to give you some examples, Black Americans are 30% more likely to die from heart disease than non-Hispanic whites. Black Americans are 40% more likely to have high blood pressure than non-Hispanic whites. And Black American women are 60% more likely to have high blood pressure than non-Hispanic white women. And, the undertreatment of heart disease in Black Americans is so prevalent. I mean, we just don't go to the doctor like we should, and men even more so than women, So I wanted to really, drive that home, because currently right now, there's no age mandated health screening for the heart. And it's the most important organ in our body. I mean, the heart is like the powerhouse. Of course, we all know it's located in our chest and protected by the rib cage. Our hearts is about the size of a clenched fist, and it weighs about the same as a grapefruit. And the heart is a powerhouse. It's a muscular organ. It pumps the blood through a network of the blood vessels in our body, and it delivers oxygen and nutrients to every cell, every nerve, every muscle, and every organ. And the right side of our heart collects blood from the body, and it pumps it through our lungs and picks up oxygen. And the left side receives oxygenated blood, and it pumps it through the body. So in a case like my husband's, you can see how things can go down pretty quickly if nobody knows it's happening, and if the doctors aren't, finding the right diagnosis and treating it. Basically, my husband almost lost his life 3 times within a 90-day period. And I did everything that I could do to be on top of it. So the types of cardiovascular diseases that we're talking about is coronary artery disease, heart attacks, stroke, and heart failure or congestive heart failure, which is what my husband had. And then abnormal heart rhythms, also known as arrhythmia, and heart valve problems, which my husband also had. He had an enlarged heart valve. So, that's just some information that I wanted to, to throw out to you all. Now, as far as risk factors, your age, gender, family history, ethnic background, if you have high blood pressure or high cholesterol, if you have diabetes or overweight, and then when it comes to your lifestyle, if you are a smoker, if you are physically inactive, if you have a very unhealthy diet or consume a lot of alcohol, all of those things are risk factors that we need to know about and that we need to be mindful of. So when it comes to what you can do to stay informed and fight heart disease, communicate with your doctor. Be able to use your voice when you know that you have a doctor's appointment coming up. Write notes. Have notes about any questions or concerns that you have. I heard one of our fellow advocates, Barbara Gaynor, talk earlier in the week on the same program about the importance of knowing your family history. So that's important to have in your notes when you're going to the doctor. And whatever your goals are. And if you can make 2 copies of those notes, and when you go into the doctor's office, give it to the person at the front desk and let them know you want the doctor to have a chance to look at this before he comes into the room. So that way, when you go to the doctor, time is of the essence. You don't have a lot of time. So if you've taken time to be prepared to follow those simple steps, it can make all the difference in the world. It can make all the difference in the world. And trust your instincts. When they diagnosed my husband with allergies, and he was really in heart failure, which of course I didn't know it at the time, but it didn't seem right. So trust your instincts, ask questions, be honest, tell your doctor the truth. If you're smoking a pack of cigarettes a day, tell the doctor that. If you're drinking 4 bottles of wine or a 6-pack of beer, tell that to the doctor. That's very important for them to know when they're trying to develop a treatment plan. And if your doctor is speaking to you in language that is not plain and it's not clear, ask for clarity. Just ask the doctor to explain it in a way that you can understand. I participated in a health literacy study, and it let us know that most doctors are not able to judge correctly a person's health literacy, so they should talk to all patients in plain language, but that does not happen. So when the doctor starts using big words and you need clarification, ask for it. Okay, it's that simple. Just ask for it. And if a doctor gives you a diagnosis and you don't think it sounds that great, ask for a differential diagnosis, meaning what else could it be? Maybe if I would have asked that question when they diagnosed my husband, Earl, with seasonal allergies, then maybe that would have caused them to dig deeper, but I did not know that at the time. So just some basic tests, for cardiovascular screening is the echocardiogram that I had already mentioned, the electrocardiogram, and a stress test. And so we can set the bar higher and be proactive versus being reactive. We can lean on our resourcefulness and all of our resilience to be able to gain access to better health care if we make these steps and also have better health outcomes. I mean, we all say we want better, but we also have to do better. And any knowledge, people say is powerful, but I say applied knowledge is power. So I want to just touch briefly on what I said about the men earlier. Sometimes men don't, maybe are not as proactive in their healthcare. According to some notes that I read in the Journal of the American College of Cardiology, researchers have found that women needed just 2.5 hours of moderate and vigorous activity per week to get the same survival benefit that men get with 5 hours. So the guys got to work a little harder to stay alive. And so the mortality risk for women who are engaged in regular physical activity was reduced by 24% compared to 15% for men. So those statistics are really kind of eye-opening to me, and that's one of the reasons why when Sandra asked me to participate, I said yes. I didn't even hesitate because I thought, this is finally my opportunity to share information that could save someone's life. And I would encourage you all to share the information with your friends and loved ones too. Now, there are a couple of reputable sites that you can go to get additional information. And if you have a pen, you might want to jot this down, but one of the sites is called huddlestudy.com. And that is the organization that we participated in research. And it is spelled, it's huddle, like a football huddle, HEDDLE study, STUDY.com. Also the American Heart Association, which is heart.org, and the Association of Black Cardiologists, which is AB Cardio. So that's A as in apple, B as in boy, cardio is in exercise.org. So when you're Googling and researching, make sure that you are going to reputable sites to get good, reliable information. And you may be able to get access to heart health screenings, tests at low cost or no cost, depending on where you live and depending on your insurance coverage. If someone does not have health insurance, the federal health centers may offer some essential health services regardless of ability to pay. So if you know someone struggling, that's an option. You can check and see if there's a qualified health center near you and use any search tools that they have. If you have pharmacies near you that offer free health screenings in February, which is National Heart Health Month, that's a good option. And if you do have health insurance, you may have no cost for basic heart checkup tests. Under the Affordable Care Act, many health insurance plans are required to cover the cost of certain preventative health screenings with no co-payment, no co-insurance, and no deductible. So depending on your health insurance, your coverage, and your age, and also your health history, you may be able to also get blood pressure, blood cholesterol, and blood sugar screenings for free as well. And just keep in mind, though, that if your doctor orders additional tests to evaluate your heart health, they may have charges for those. So that may be something that you want to ask about so you're not surprised when you get a bill or are told that you have to pay a certain amount of money out of pocket. But again, this is your health that we're talking about. So if you have a health insurance, you can always contact your health insurance provider to learn if you're eligible for any type of free health screenings, and then also ask them about the cost as well. And last, if you are employed and you have a health savings account, learn about those benefits too. So that's pretty much all I have. I know I gave a lot of information there, but again, this was just something that was really on my heart to share, and I would encourage you all to share it with your loved ones as well. I don't really have anything more to add today, but I just hope that you will take all of what I said to heart, because it is a matter of life and death. And thank you all for listening.
Darlene, thank you so much for coming to us this evening. You took time out of your busy day. We've been struggling not all day, but for a large part of the day. But we hung in there, which is what we always do. And I do want to say thank you to Jay, Kelly, Tracy, and Carolyn for coming in. If you ladies have a question that you want to ask her, please go ahead and raise your hand so that we can get her to answer that question. What I do want to share with those of you who are both on Facebook and on LinkedIn is this. All week, well, not even all week, all month, we've started with talking about the importance of being transparent in your healthcare, of communicating with your doctors when it comes to your healthcare. This is your health. You hear it again tonight. Darlene, overall message was about be proactive. Tell the truth. What would have happened if she would have taken her husband to the hospital with an emergency, especially the emergency room doctors, because they normally do not have any of your health information whatsoever. So you're really going in there blind. But say she went in there for treatment to get him treated and she wasn't honest. maybe they would have given them the right medication. Maybe they wouldn't have. That's a choice that she had to take. If she would have went to the doctor's office and not been open and not been honest with what she said. But once again, she's echoing the same thing that we have heard over and over and over again throughout this month, which is you have to be transparent when you go to the doctor's office. You have to communicate when you go to the doctor's office. If you don't communicate because you don't feel comfortable with your doctor, or there's another level of mistrust especially with the African American community, when it comes down to what is known as the white coat syndrome, which is anyone that actually has a white coat or is in a white coat position, meaning any clinician. If you don't feel comfortable and confident in talking to that team that you have, you need to find another doctor, is what you need to do. You don't need to be, just wasting your life away hoping and praying that things get better, because things are not going to get better on their own. And they're not going to get better with you thinking that the doctor could read your mind. Or you thinking, well, you know what, I'll just go ahead and give him an opportunity to, maybe he'll tell me something. Especially with our seniors, we just can't continue to go down that path. So I do have a couple of questions for you, Darlene. I know that, in reading your bio, you talk about the Sports Philanthropy program that you're now in a managing role with. Do they also, do they have a health and wellness section where they work with participants to, help them, should they need like screenings, like heart screenings, especially heart screenings, especially with sports? Do they have something like that available?
Sandra, that is a great question, and I'm glad that you asked that. Yes, the Sports Philanthropy Network is currently in 22 cities, and by the end of the year, they expect to be in 30 cities. And one of their main focuses with their health and wellness or health and safety initiatives is heart screenings. And they also have nutrition, and so they connect people in the community with these types of screenings so that they can stay healthy. They also have mental health awareness as well. And that's one of the reasons why when I was invited to participate, it was the perfect opportunity for my husband and I to continue the work that we've been doing. So if you, I will be happy to send information if anybody is interested, a list of the cities so they'll know if there is a city near them that has these heart screenings, and also when they have different activities that are going on, because they are very active in the community.
Now, are those programs, are they specifically just for the participants, or are they for the participants and the family, or do they actually work with the community where, not just the, people, not just the kids and the young adults or the adults that are doing the sports, but also with the community? Are they embedding that program into the community so they can help in the community as well?
Yes, as a matter of fact, they are, because one of the things that Sports Philanthropy Network does is partner with nonprofits, athletes, and influencers in the community. So when they have these different events, a lot of times they'll have different athletes come and do autograph signings or have sports activities with the kids. So yes, the activities that they do are community-based.
Okay, so with the activities, will they also be able to take part in the screenings and all the other health related events that they have, or is there like a limit to what they can participate in?
And that also is the good question, Sandra. And I think it would depend on the event. So that's one reason why I would recommend if someone is in a city where they have events going on, to be able to check out what the event is, because I know that they are pretty active. They have lots of things going on. So I wouldn't say it's a blanket health screening for the community every time, but I know that they have lots of events going on, and it would be, I would say, on a case-by-case basis.
Now, as far as the ages for those that can participate in the sports philanthropy, and I would, and I'm asking that question because we all need to be doing something healthy, some type of exercise, some type of something. And so I would think that everybody that went there, there
Yes.
would be something for everyone there. So is there an age limit on who can participate in the sports philanthropy programs?
Well, the Sports Philanthropy Program, as I mentioned, they do partner with nonprofits, they partner with athletes and community influencers. So people that are able to actually join the organization do need to fit into those categories, but the activities that they have in the community, from what I have seen, many are open to the community.
Okay, well, you know what? That's certainly good information to know. And for those of you that are looking at this tonight, or whether it's on LinkedIn or whether it's on Facebook, or at any point in time that you are, and you like are into the sports, that into sports, and you want to see if there's a way that you can have them come out, to have an organization, sign up with the organization to see if they're available in your area or in the area close to you. By all means, reach out. That's what we're here for. Once again, these links for these shows are all available. All you have to do is send me an email, send me a link through a message through LinkedIn, a DM through Facebook. You have my website, which is www.medihelps, which is medihelpz.com. Reach out to me and say, hey, Sandra, we want to talk to Darlene, or we will, and I'm telling you, she's really ready to talk. Because one of the things that we talked about before this call was professional speaking and professional personal speaking, public speaking. So she's interested in talking, and she's interested in getting the message out there, not just so much about her husband, but also about the work that the two of them do, the faith-based work, as well as the Sports Philanthropy Network that they work with. She's looking to get out there. She's looking to speak. She's looking to bring awareness to those things for everyone, but especially for our community, because our community needs programs like this. We need to know where they are. We need to take part in them, because we don't want them to go away. If they come into our communities, they're coming for a reason. They want to help. So if you don't use those resources, a lot of times they'll go somewhere else where they think that they'll get more feedback from. So please continue to use those programs. And Darlene, before we close for the night, what I do want to ask you is, how does someone get in touch with you should they want to reach out to you and get you involved in their network?
Okay, so if someone wants to reach out to me, of course, you can reach out to me directly here on LinkedIn or Facebook. And if you would like to send me an email, you can email me at Darlene, Darlene, at Darlene Christy, my last name, Christy, cares.com. So that is Darlene at DarleneChristyCares.com.
Okay.
And one tidbit that I did want to mention, I do have a special place in my heart for working with seniors, solo seniors, so specifically those seniors who may not have loved ones nearby. And we will also be launching initiatives to work with military and veterans. So those are things that are on my horizon in the very near future. I am in the process right now, so stay tuned shortly to see my newly born company birth, which is My Healthcare Champion. So when that website is up and available in about the next week or so, you'll be able to go at what I've been doing and that we will be doing in the future.
Well, I certainly thank you for that. I know the Charms Many Helps Foundation also thanks you for coming in tonight, sharing with us tonight your thoughts and your concerns. February is Cardiovascular Health Month. So this was a perfect opportunity to actually come and bring us information in reference to what we're focusing on in the health community. this month, which is their heart health for men, and especially their heart health for women, because women are just as prone to having heart conditions, especially African American women, because we carry so much, right? We really carry so much on us and with us, till we have to be mindful. We carry our kids, our husband, whoever it is, we're carrying them. So women, we have to be careful. We have to, continue loving on our husbands, continue being there in that corner for them when they need help, because we need them. Men, we need you. So please do what you can to protect your health, to go to the doctor, to get checkups, to do all those things. And Darlene, before we go for the evening, I do want to say this. Your husband is blessed. And thank you, Constable, for coming in this evening. Darlene, your husband is blessed. And I hope he knows that he's blessed. I know he does, but I'm just really, really hoping, because you know what? You stood with him. You stood by him. You stood with him. You was like, we ain't going down like this. And you determined within yourself that you were going to learn those skills that you needed to learn in order to be able to take care of him. To bring, look, babe, we going home and I'm going to take care of you. Especially, I saw your pictures where, and I wanted to bring this up. I saw your pictures that you had posted on LinkedIn, where you made his hospital bed, his hospital room, like he was at home. You had pictures, you had the same comfort of home you had in that hospital room. And I don't know with many people, when they have a loved one that's that sick and, that really wants to be home, but you can't go home, you're not well enough or strong enough or what, you made that room look like it was your bedroom. You did the whole thing. And so, when it comes down to you wanting to have a speaker that can come in and give you tips on how to do things to make those who are sick, make them feel healthier. Because if they feel healthier mentally, physically, they're going to do the same thing. Their bodies are going to begin to pick up and do, what they should be doing to be healthy. So with that being said, I'm going to close out this evening. But before I close out this evening, can you please, please, please give us 3 tips that you will want all of us to remember about cardiovascular health?
Absolutely. So I knew you were going to ask me this question, and I was ready, Sandra. Okay, so I have 3 tips, and the tips that I chose, they are tips. These tips are tips that can apply to your health, whether it's cardiovascular or other health, and your life in general. All 3 of these tips. And the first tip that I have is never stop learning. Keep learning. So that's when I talked about, if you're going through a particular health challenge or whatever, and you want to go and do research so that you can be somewhat educated about what's going on, to go to reputable websites, learn, do research, keep learning. So whether that's regarding your health, your relationship, your finances, your spiritual growth, your career, whatever it is. We don't mind going to college and getting all these degrees and, going and studying different things. But when it comes to our health, that needs to be at the forefront. So never stop learning. Never stop learning. That's tip number 1. The tip number 2 I have is share information that you have so you can help uplift and empower others. Imagine how informed our world and our communities would be if we share the information that we learn versus keeping it for ourselves because we don't want to share or don't want other people to know what we know. So imagine if we use that information to share it so that somebody else's life can be saved or improved. So never stop learning, number 1. Tip number 2, share information that you have to uplift and encourage other people. And the last tip I have, connect with people that are on a similar journey. So if you're trying to improve your credit or improve your finances or improve your health or improve whatever area it is in your life, then you need to partner up with people that are on a similar journey. Because if you're trying to lose weight or you're trying to, buy a home or whatever it is, and you're want to eat at McDonald's and fast food and be gluttons on the weekends or whatever. I mean, that's kind of like peer pressure that you don't really need. And that applies to any area in your life. If you're going to have goals, connect with people who have been there or are on the same journey so that you can be empowering to each other. So those tips, I feel, can be applied in any area of your life. And hopefully you'll apply it in your health, but you can apply it in other areas of your life as well.
And with that being said, I want to wish everyone, whether you're watching this at this evening while this is being while we are actually doing this live, or whether you're watching it in the afternoon or the morning time, whenever you're looking at this video, please do take what Darlene said to heart, and please watch your heart, right? We only get one life. Let's do what we need to do, especially in our community. Let's do what we need to do to make sure that we protect our heart and that we take control in charge of our health care journey. With that being said, I am going to go ahead and close out this video. Thank you so much for watching and viewing. Appreciate you all.